His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. It was a late autumn evening, the kind where the sky goes dark too early and everyone inside feels it, that low-grade melancholy that settles into waiting rooms like old furniture. I was doing a rotation at a community clinic on the edge of town, the kind of place where the fluorescent lights hum just a little too loud and the coffee is always slightly burnt and somehow still comforting. My supervisor had stepped out to deal with a supply issue, and the nurse at the front desk had waved me toward room 4 with the casual authority of someone who has seen 1,000 nervous students and trusts them anyway. "Guy in 4, she said, not looking up, "needs his B12. He's been putting it off for 3 weeks. 3 weeks. I picked up the chart and walked down the hall, and I remember the smell, antiseptic underneath and something warmer, like someone had brought in coffee from outside. The little details you notice when you're trying not to be nervous yourself. I knocked twice and pushed the door open. He was sitting on the exam table, still in his coat, dark wool, slightly damp from outside. Somewhere around 30, maybe a little older, with the kind of face that looked like it was usually more relaxed than it currently was. He had his hands pressed flat against his thighs, which is something people do when they're trying to hold themselves still. I recognized it immediately because I do the same thing at the dentist. "Hi," I said. "I'm going to be taking care of you today." He looked at me for a moment. "You look very calm," he said. "Is that on purpose?" I smiled. "Little bit, yeah." His name was Daniel. He'd been referred for intramuscular B12 injections, a series of them, for a deficiency that had been quietly draining him for months. Fatigue, brain fog, the kind of tired that sleep doesn't fix. He'd finally gone to his doctor after falling asleep at his desk 3 times in 1 week. His words. He said it like it was funny, but his eyes said it had scared him. "So," he said, as I sat at my tray, "how many of these have you done?" I laid out the alcohol swabs, the syringe, the small vial. I kept my movements slow and deliberate, not because I was uncertain, but because I've learned that watching someone prepare carefully is its own kind of reassurance. Rushed hands make people nervous. Steady hands make people breathe. "Enough," I said, which was true. "That's not a number." "It's not supposed to be." He almost laughed. Almost. I asked him to take off his coat and roll up his sleeve, and then I explained what we were actually doing, because I think people deserve to know. A B12 injection goes into the muscle, not the vein. Most commonly the deltoid. That's the muscle on the outer part of the upper arm, the rounded one, or sometimes the gluteal muscle if the dose is larger or the deltoid is too small. For Daniel, the deltoid was perfectly fine. I told him that. I told him the needle would be short, about 1 inch, one of the thinner gauges we use for this kind of injection, and that the sensation would be pressure more than pain, and that the worst part for most people is the anticipation. "Is that true?" he said. "Or are you just saying that?" "Both," I said honestly, "but mostly true." The trick with intramuscular injections, and I mean the real trick, the one that makes the difference between a patient who winces and a patient who barely feels it, is muscle relaxation. A tense muscle hurts. A relaxed muscle barely registers the needle at all. So before I do anything, I talk. I ask questions. I let the person get used to my voice, my presence, the fact that I'm not in a hurry. I asked Daniel about the brain fog, what it felt like, when it started. He started talking, and I watched his shoulders drop about 1/2 inch. That's when I cleaned the site. The alcohol swab is cold, and I always warn people. "Little cold," I said, and he nodded, and I wiped the outer part of his upper arm in a small circle, letting it dry for just a moment, because alcohol on the skin needs a few seconds, and a wet site stings more than a dry one. Small thing. Matters. I held the syringe the way you'd hold a dart, not gripping it, just resting it between my fingers, confident but not tight. 90-degree angle to the skin. That's important. Intramuscular means you're going straight in, not at a shallow angle like you would for a subcutaneous injection. You want to reach the muscle, not just the fat layer beneath the skin. Keep talking, I said quietly. About what? Anything. He said something about a book he'd been trying to finish for 6 months but kept losing the thread of, and I inserted the needle in one smooth, continuous motion, not hesitating, not slowing down mid-entry, because hesitation is what causes pain. The muscle barely registered it. I drew back the plunger just slightly, a quick check to make sure I hadn't caught a blood vessel. Nothing. Good. And then I pressed the plunger down slowly, steadily, giving the muscle time to receive the solution without pressure building too fast. He stopped talking mid-sentence. "Did you?" he started. "Already done," I said. He looked at his arm like it had done something without telling him. "That was it?" "That was it." I withdrew the needle cleanly, pressed a small piece of gauze to the site, not rubbing, just gentle pressure for a moment, and disposed of the syringe immediately, the way you always should, directly into the sharps container without recapping. Never recap a used needle. It sounds like a small rule until it isn't. Daniel flexed his hand experimentally, like he was checking that his arm still worked. "I've been putting that off for 3 weeks," he said. "I know." That was genuinely nothing. "Most things are," I said, "once you stop imagining them." He pulled his sleeve back down and sat there for a moment, and I started making notes in the chart, and the room was quiet in a comfortable way. The kind of quiet that settles after something that felt large turns out to be small. I mentioned, while I wrote, that B12 deficiency is one of those things that sneaks up on people, especially if they've been under stress or eating differently, or if they're on certain medications that interfere with absorption. Metformin is a common one. Proton pump inhibitors, the kind people take for acid reflux, can affect it too. It's worth knowing because the symptoms look like a dozen other things: fatigue, mood changes, difficulty concentrating, even tingling in the hands or feet if it's been going on long enough. People often assume they're just tired or anxious or getting older. Sometimes the answer is simpler than that. "Should I be eating differently?" he asked. More animal products help: meat, fish, eggs, dairy. But if absorption is the issue, diet alone often isn't enough. That's why you're here. He nodded like he was filing that away somewhere useful. Before I left, I told him to take it easy for the rest of the day, not because the injection required it, but because his body had been running on empty for months, and it deserved a little grace. I told him that if the site felt sore later, a warm compress for a few minutes would help. Not ice. Warmth. Ice constricts blood flow. Warmth encourages the muscle to absorb the solution and eases any residual tension. He thanked me. And then, as I was almost at the door, he said, "Can I ask you something?" I turned. "Do you actually like doing this? Like, the needles, the clinic, all of it?" I thought about it for a second. The honest answer. "I like the moment right before," I said, "when someone's nervous and then they're not anymore. When the thing they were afraid of turns out to be smaller than they thought." I paused. That part never gets old. He looked at me for a moment with something in his expression I couldn't quite name. Not quite a smile, not quite something else. Just a kind of quiet recognition. "Yeah," he said. "I can see that." I walked back down the hall, past the humming lights, past the slightly burnt coffee smell. and I thought about how much